Station 3. Then middle-aged diabetic Chinese male with ulcer in nasopharynx on recent chemo and radiotherapy. Okay. Middle-aged diabetic Chinese middle male with ulcer in nasopharynx on recent chemo and radiotherapy. Okay. Risk factor of nasopharyngeal carcinoma. Middle-aged diabetic Chinese male with an ulcer in recent chemo and radiotherapy. Okay. Risk factor of nasopharyngeal carcinoma. Non-modifiable nasopharyngeal carcinoma risk factor. Non-modifiable, modifiable. Non-modifiable gender. More in male genetic factor. More in male genetic factor. More in male genetic factor. More in male than genetic factor. More in male. Non-modifiable, modifiable. Nasopharyngeal carcinoma. Nasopharyngeal carcinoma non-modifiable. Gender more in male. Genetic factor, family history, ethnicity and race common in southern China, Singapore, Vietnam, and Malaysia. Common in southern China, Singapore, Vietnam, and Malaysia. Common in southern China, Singapore, Vietnam, China, Singapore, Vietnam, and Malaysia. China, Singapore, Vietnam, and Malaysia. Ethnicity. Ethnicity and race common in southern China. Okay. Ethnicity common in southern China, Singapore, Vietnam, and Malaysia. Non-modifiable. So non-modifiable is more in male, more in male genetic factor, family history, and ethnicity common in southern China, Singapore, Vietnam, and Malaysia. Modifiable infection, infection with the Epstein-Barr virus, tobacco and alcohol use, infection with the Epstein-Barr virus, tobacco and alcohol use, diet, consumption of salted fish containing carcinogenic volatile nitrosamine. Okay, diet, consumption of salted fish, consumption of salted fish, consumption of salted fish, consumption of salted fish containing consumption of salted fish containing consumption of salted fish containing volatile nitrosamine. Okay, define carcinoma. Carcinoma is a type of carcinoma. This is a type of cancer that develops from epithelial cell. Carcinoma. This is a type, carcinoma of the neoplasm that develops from the epithelial cell. Carcinoma. The type of cancer that develops from the epithelial cell. Differential diagnosis. Tumor like lymphoma, angiofibroma, rhabdomyosarcoma. Tumor like lymphoma, angiofibroma, rhabdomyosarcoma, angiofibroma, rhabdomyosarcoma, 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 and rhabdomyosarcoma. Lymphoma, angiofibroma, rhabdomyosarcoma, lymphoma, angiofibroma, tumor like lymphoma, angiofibroma, rhabdomyosarcoma, adenoid hypertrophy, adenoid hypertrophy, infection, adenoid hypertrophy infection, like abscess hematoma. What are other non-epithelial tumor can be? What are non-other epithelial? Okay, tumor like lymphoma, um, angiofibroma, and rhabdomyosarcoma, adenoid hypertrophy. Angiofibroma, rhabdomyosarcoma, adenoid hypertrophy, infection, abscess, and hematoma. There could be infection, hematoma, infection, infection, abscess, hematoma, adenoid hypertrophy, lymphoma, angiofibroma, rhabdomyosarcoma. What other epithelial tumor can be here? What other non-epithelial tumor can be here? Lymphoma, usually non-Hodgkin, non-Hodgkin lymphoma. Waiting for this answer. What are other non-epithelial tumor? Non-epithelial tumor can be here is a lymphoma. Lymphoma, usually non-Hodgkin lymphoma, rhabdomyosarcoma, and angiofibroma. Rhabdomyosarcoma, and angiofibroma. Angiofibroma. Rhabdomyosarcoma, rhabdomyosarcoma, angiofibroma. Angiofibroma. If palpable lymph nodes, how to assess? What simple pathological investigation assess the nodes status? If palpable lymph access, if palpable Newton, what simple pathological investigation assist in assessing the nodal status? Start by FNSC, then maybe needed excisional biopsy. I will start with the FNSC. Then maybe need excisional biopsy. I will start with FNSC, then I may need to do excisional biopsy. What is cytology process? Cytology is the study of the cellular structure and the function, and histology is the study of the tissue under microscope. uh, Scale of radiation and dose, what are SI unit measurements in is commonly used in measurement of radiation dose. We use gray, GRAY, gray. Scale of radiation we use gray. Scale of radiation we use gray. If swab grows high pitch. What do you think? It is a fungal infection, mainly candida. Fungal infection, mainly Candida aspergillosis, Mycosporidium, phyton, epidermatophyton. Pattern of spread, lymphatic spread and local invasion. Lymphatic spread, local invasion. Pattern of spread, it is candida, lymphatic spread and local invasion. Explain the local. Explain the local invasion. Sphenoid sinus, cavernous sinus, local invasion into. Okay, from there, local invasion where? Cavernous sinus, cavernous sinus. Nasopharyngeal version, sphenoid sinus, cavernous sinus, oropharynx, cervical, one vertebral base of the skull. Cavernous sinus, sigmoid sinus. Cavernous sinus, sphenoid sinus, sphenoid sinus, oropharynx, cervical one, no, oropharynx, cervical one vertebral base of the skull, nasal and paranasal cavity, orbital invasion, lateral pharyngeal space, lateral parapharyngeal space, middle ear cavity. The middle ear cavity. if the patient has a infection and a swab shows fungal infection from the stem, what is the predisposing factor to this infection? Fungal infection and diabetic immunosuppression from chemotherapy and diabetic predisposing factor for this infection is diabetic immunosuppression from chemotherapy and dead tissue from the pharynx due to radiotherapy. Dead tissue from the pharynx due to radiotherapy. Ulceration, which is more prone to fungal infection. Diabetic immunosuppression from chemotherapy and dead tissue from pharynx due to radiotherapy ulceration, which is more prone to fungal infection. Radiotherapy, diabetic diabetic immunosuppression from chemotherapy. Diabetic immunosuppression from chemotherapy. Diabetic immunosuppression from chemotherapy and dead tissue from the pharynx, and dead tissue from the pharynx due to radiotherapy ulceration, which is more prone to fungal infection. Okay, how is radiotherapy act against malignant tumor? How is radiotherapy? Mm, how is radiotherapy act against the malignant tumor? Radiation directly deliver high energy to tumor DNA, causing directly tumor DNA causing direct damage to the DNA and indirect generation of free radical causing further cellular damage. Mm, direct indirect damage to the direct damage DNA damage and other tumor cell, and indirect generation of the free radicals which further damage the causes cell damage. What are the steps needed for the malignant tumor to spread from nasopharynx to the cervical lymph node? Nasopharynx to the cervical lymph node. Tumor grows in nasopharynx without tumor grows in nasopharynx without any control. That the tumor cell penetrate or invade the locus of the tumor cell tumor cell grows in the nasopharynx without any control. Tumor cell grows without any control in the nasopharynx, and tumor cell penetrate the surrounding local tissue. Tumor cell grows in nasopharynx without any control. Tumor cell penetrates the local tissue, then tumor enter the lymphatics and embolizes to distal nodes. Tumor enter the then tumor enter the lymphatics. Then tumor enter the lymphatics and tumor enter the lymphatics and embolizes. Tumor enter the lymphatics and embolizes to distal nodes. Tumor enter the tumor enter the lymphatics. Tumor enter the lymphatics. Tumor enter the lymphatics and tumor enter the lymphatics and tumor enter the lymphatics and embolizes to the distal node. Tumor enter the lymphatics. Tumor enter the lymphatics. Tumor enter the lymphatics. Tumor enter the lymphatics and enter the tumor enter the lymphatics. Tumor enter the lymphatics. Tumor enter the lymphatics and tumor enter the lymphatics and embolizes into the distal node. Then the tumor grow. Then the tumor grow. Then the tumor grow in the node. So first, tumor grow in nasopharynx without any control. Then tumor um, invade the surrounding tissue. Then tumor enter into the lymphatics um, and embed and embolizes to the distal nodes. Then and then the tumor grow in the distal nodes, like in the cervical nodes. How immunohistochemistry confirm this is a carcinoma by antigen antibody recognition. Use antibodies antibodies to bind to epithelial cell, then visualize under a microscope. In simple words, define present section. It is a pathological laboratory procedure. It is a pathological laboratory procedure to perform rapid microscopic analysis of a. It is a pathological laboratory. It is a pathological laboratory. It is a pathological laboratory examination. It is a pathological laboratory examination to perform rapid microscopic analysis of a specimen. It is a pathological present section. It is a pathological it is a pathological laboratory procedure to perform rapid microscopic to perform. It is a pathological laboratory procedure to perform rapid microscopic examination of a specimen, to perform rapid microscopic analysis of a specimen. Can you explain more about the steps? And the surgeon cut a simple tissue from the tumor and then send it to the lab for analysis. Then the pathologist freeze it, section it, and cut it in the freeze it and section it, freeze it and section it, and then cut it. Then the section will be stained. Then the section is stained and repeat. Then the section will be stained and examined under microscope. And then the section will be stained and then reported immediately when the reports come on over phone. If you are subscribed in the surgery and waiting for the result of present section, how will they tell you the result by telephone? If the section will be stained and come on. Okay. Risk factor of an nasopharyngeal carcinoma. Risk factor of non-modifiable, non-modifiable genetic factor, family history, ethnicity like Southern China, China, Malaysia, Vietnam, and male gender and family history, and gender more in male, and genetic factor, family history, and ethnicity, and non-modifiable infection with the Epstein-Barr virus and tobacco and alcohol use. Infection with Epstein-Barr virus, tobacco and alcohol use, and diet consumption of salted fish containing carcinogenic, volatile, and nitrosamine containing nitrosamine. And even carcinoma, it is a malignant tumor of the epithelial cell. A differential diagnosis tumor like lymphoma, angiosarcoma, and lymphoma, rhabdomyosarcoma, angio, fibroma, lymphoma. And lymphoma, 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 lim, lim, lymphoma, angiofibroma, and rhabdomyosarcoma. Adenoid hypertrophy. Adenoid hypertrophy, infection, abscess, and hematoma. What is the non-epithelial tumor? Non-epithelial lymphoma, Hodgkin's lymphoma, rhabdomyo. Rhabdomyosarcoma, and angiofibroma. If a palpable, first I will go for FNC and then definitive extraction and biopsy. Cytology, study of the cellular structure under structure and strategy of the cellular structure and function. Histology, study of the tissue under microscope. Scale for radiation gray fungal, mainly candidiasis. Fungal mainly candidiasis spread of pattern, spread and lymphatic spread and local infection. Fungal candida, lymphatic spread, local invasion. Explain the local invasion. Spinat, sinus cavernous sinus, cervical vertebra, oral cavity, middle ear cavity, oropharynx, base of the skull, oropharynx, cervical one vertebra, base of the skull, and nasal and paranasal cavity, orbital invasion, orbital middle ear cavity, diabetic, if the patient has infection and swab shows fungal infection, from where this could be, it could be immunocompromised due to chemotherapy, and dead tissue from the pharynx due to radiotherapy. Dead tissue, diabetic immunocompromised dead tissue from the pharynx due to radiotherapy. Ulceration, which is more prone to fungal infection. Dead tissue from the radiotherapy, which is more prone to fungal infection. How radiotherapy directly they damage the DNA of the tumor cell, and indirectly they produce free radicals, which causes cell damage. Steps in okay. First, the tumor grow in the nasal, first the tumor grows in the nasopharynx without any control. Then it penetrates the local tissue. Penetrate tissue, and then enter the lymphatic and embolize to the distal node. Then in the distal node, like in the cervical node, they grow immunohistochemistry and is an antibody recognition. It is a it is a pathological laboratory test which is performed to rapid microscopic analysis of a specimen. Rapid microscopic analysis of when the surgeon take a small piece from the tissue or from the tumor and send it for the analysis. The pathologist frozen it, section it, and cut it. Then the section will be stained and reported immediately when the result comes out. If you are swabbed by telephone. Okay. So, what is carcinoid? Carcinoid is a slow-growing type of neuroendocrine tumor originating in the cell of the neuroendocrine system. Slow-growing type of neuroendocrine tumor. Slow-growing carcinoid is a slow-growing type of neuroendocrine tumor. Slow-growing type of neuroendocrine tumor originating in the cell of neuroendocrine system. একই কথা. Slow-growing type of neuroendocrine tumor. Slow-growing type of neuroendocrine tumor originating from neuroendocrine system. What is the most common site or found? Small intestine, appendix, terminal third, appendix, terminal third. প্রথমে হচ্ছে স্মল ইন্টেস্টাইন, অ্যাপেন্ডিক্স, রেকটাম, স্টোমাক, and lung. So stomach, small intestine, appendix, rectum, and lung. That's a common site. What are the methods to diagnose carcinoid? Methods of diagnosis carcinoid: chromogranin A in the blood, AB, chromogranin A in blood, and 5 HIAA, hydroxyindolectic acid, hydroxyindoleacetic acid, 5 hydroxyindoleacetic acid, 5 HIAA, testing in urine, HIAA, 5 HIAA in urine. Are immunohistochemistry for chromogranin B. Immunohistochemistry for B. Okay. তাহলে কার্সিনয়েড ডায়াগনোসিস হবে কিভাবে? কার্সিনয়েড ডায়াগনোসিস হবে chromogranin A in blood, 5 hydroxyindoleacetic acid, 5 hydroxyindoleacetic acid, 5 hydroxyindoleacetic indole acetic acid, 5-hydroxy indole acetic acid in 24-hour urine, 5-hydroxy indole acetic acid, 5-hydroxy indole acetic acid, 5-hydroxy indole acetic acid, 5-hydroxy indole acetic acid in urine, 5-hydroxy indole acetic acid in urine, 5-hydroxy indole acetic acid in urine, and immunohistochemistry যদি করব chromogranin B. Okay, what does it release? Means carcinoid কি রিলিজ করে? carcinoid রিলিজ করবে হিস্টামিন, সেরোটোনিন, ব্রেডিকাইনিন, প্রোস্টাগ্ল্যান্ডিন, হিস্টামিন, সেরোটোনিন, bradykinin, prostaglandin, and substance P and teikinin. Histamine, bradykinin, serotonin, HBS. Okay. Histamine, serotonin, bradykinin, prostaglandin, substance P. Histamine, bradykinin, serotonin, then substance P and prostaglandin, HBS, SPP. Histamine, bradykinin, serotonin, substance P, and prostaglandin, teikinin. Which cells are involved? Which cells are involved? এখানে আছে enterochromaffin cell in the crypt of liver cone. Enterochromaffin cell in the crypt of liver cone. Enterochromaffin cell in the crypt of liver cone. When does it become symptomatic? Which cell are involved? Enterochromaffin cell in the crypt of liver cone. When does it become symptomatic and why? When does it become symptomatic? When it is metastasized to liver. When it is metastasized to liver, then it becomes symptomatic. Why? Most of the blood circulating from the GIT must pass through the liver before it reaches the rest of body. Most of the blood circulating from the GIT must pass through the liver before it reaches the rest of the body. The liver has strong enzyme that breaks down the neutral breaks down liver has strong enzyme that break down and neutralize most of the excess serotonin and other substances produced by the carcinoid tumor, preventing them from reaching tissue. But when carcinoid tumor metastasizes to liver, this substance can more easily reach tissue where they can cause symptoms. Okay. In general, our liver break down and neutralizes most of the substances produced by the carcinoid. But when carcinoid is already in the metastasized to liver, then it becomes very easy. That it becomes very easy for the substance to reach the tissue and produce their symptoms. Okay. Sign and symptoms of carcinoid spread. কি কি দেখলে আমরা বুঝবো যে carcinoid spread হয়ে গেছে? একটা হচ্ছে periodic abdominal pain, manifestation of carcinoid syndrome, cutaneous flushing, diarrhea, asthma-like syndrome, and cardiac manifestation like valvular heart disease, fibrosis of the endocardium. Periodic abdominal pain, carcinoid syndrome কি হবে? periodic abdominal pain, cutaneous flushing, periodic abdominal pain, cutaneous flushing, diarrhea টা important even when patient maintain fasting তখনও ডায়রিয়া হবে। তাহলে periodic abdominal pain, cutaneous flushing, diarrhea, asthma-like symptom, valvular heart disease, fibrosis of the endocardium, valvular heart disease, fibrosis of the endocardium. Okay. Most common metastatic site in liver. Most common metastatic site হচ্ছে liver. What is the immunohistochemistry? It is a method of localizing specific antigen in tissue or cell based on the antigen antibody recognition. Procedure of immunohistochemistry এটা আমরা অনেকগুলো স্টেশনে দেখছি। Antibody are linked with the enzyme or a fluorescent dye. Antibodies are linked with the enzyme or fluorescent dye. When the antibodies are bind to the antigen in the tissue sample, the enzyme or dye are activated and they will be visualized under the microscope. The significance of the process is to be detected. The significance of the procedure is to detect certain antigen. Yes. What specially does it? Which specialty does it? Pathology. Significance of immunohistochemistry in carcinoid. Carcinoid immunohistochemistryতে তারা রেকগনাইজ করবে ক্রোমোগ্রেনিন বি, আর আমরা ব্লাডে করব ক্রোমোগ্রেনিন এ। ক্রোমোগ্রেনিন বি ডিটেক্ট হবে ইমিউনোহিস্টোকেমিস্ট্রির মাধ্যমে, আর এমনিতে ক্রোমোগ্রেনিন এ ডিটেক্ট করব আমরা ব্লাডে। আর ইউরিনে আমরা দেখব 5-HIAA, 5-hydroxy indole acetic acid. After surgery, pseudomembranous colitis was suspected. Pseudomembranous colitis was suspected. After surgery, pseudomembranous colitis was suspected. Sign symptom: pseudomembranous colitis, এটা করবে bloody diarrhea, abdominal pain, bloody diarrhea and fever. Abdominal pain and pseudomembranous colitis, yes, এটা করবে abdominal pain, bloody diarrhea and fever. Fever. Only one test to detect pseudomembranous from the clostridium, এটা মনে হয় colonoscopy, maybe colonoscopy. Colonoscopy. Other test to diagnose pseudomembranous colitis: serological test like ELISA. Serological test like ELISA. Serological test like ELISA. আর তিনটা চারটা প্রশ্ন আছে আরো। He presented with a liver lesion for which resection done and histopathology report showed granulomas with necrotic core. Granulomas with necrotic core containing adult helminthes, Enterobius vermicularis. Enterobius vermicularis. Okay, তাহলে এটা কি হয়ে গেছে এখন? He presented with a liver lesion for which resection done and histopathology reported showed granulomas with necrotic core containing adult helminthes, Enterobius vermicularis. What is Enterobius vermicularis? It is a pinworm from the nematode family. Enterobius vermicularis is a pinworm from nematode family. Pinworm from nematode family. Nematode family. Why this patient need regular iron supplementation? Yes, the patient has iron deficiency due to affection of the liver. Liver from the worm. The patient has iron deficiency. The patient has iron deficiency due to affection to the liver by the worm. Iron is stored in the liver in the form of ferritin. So this storage form is not there. That's why patient need daily iron supplementation. The patient was in iron, and the patient has iron deficiency due to affection of the liver by worm. Okay. আরেকটা সিনারিও, এটা দুইটা সিনারিও, টাইম শেষ। Middle aged man with right iliac fascia pain, surgery was done, revealed dilated appendix, looks like a mass. Histopathology revealed appendicular abscess plus 6 mm appendicular mass involving the mucosa and the muscularis layer. What is the TNM classification of this tumor? Invade muscularis, then it is T2, কোনো lymph node বলে নাই, সুতরাং NX, and metastasis নাই, MX। সুতরাং যেহেতু মিউকোসা ইনভলভ করছে, সুতরাং এটা T2, N either 0 অথবা X, কারণ নট ডিটেক্টেবল, এন্ড M কিছু বলে নাই, সুতরাং এটা X। What is the management needed for this tumor? If the tumor is symptomatic, then conservative management. কি কি কমপ্লেন থাকে? Periodic abdominal pain, abdominal spasm, periodic abdominal pain,
ডায়রিয়া,
bloody diarrhea, আর
ফিভার থাকবে,
cutaneous flushing. Cutaneous flushing. Periodic abdominal pain, ওই যে কার্সিনয়েড সিনড্রোমের ভিতরে ফিভার আসে। Periodic abdominal pain, cutaneous flushing, diarrhea, asthma-like syndrome, and valvular heart disease, valvular heart lesion, fibrosis of the endocardium, cardiac manifestation. Again, periodic abdominal pain, cutaneous flushing, এটা বলা হয় থাকে periodic abdominal pain, cutaneous flushing, diarrhea. Periodic abdominal pain, cutaneous flushing, diarrhea, asthma-like syndrome, valvular heart disease. তাহলে if the tumor is symptomatic, then conservative management, somatostatin analog and antidiarrheal, somatostatin analog. If the tumor is symptomatic, then conservative treatment, and if it fails, then surgery. If the carcinoid is less than 2 centimeter, appendectomy. If carcinoid less than 2 centimeter, then appendectomy. And if more than 2 centimeter, তখন আর appendectomy করে লাভ নেই. Right hemicolectomy, right hemicolectomy with lymph node and ileocholic anastomosis. Right hemicolectomy, right hemicolectomy, right hemicolectomy with lymph node and ileocholic anastomosis. Ileum সাথে এখানে columnar anastomosis. তাহলে if tumor is less than 2 centimeter, appendectomy, and if it is more than 2 centimeter, right hemicolectomy with lymph node excision and ileocholic anastomosis. Okay. এখন রিভিশন মোড ভেরি র্যাপিড 2 মিনিট আর সাথে ব্রেক টাইমের 5 মিনিট। Appendicular carcinoid detected incidentally, 8 millimeter size. আপু কারিজাপুর হ্যাঁ হ্যাঁ আমরা ইন্ডিভিজুয়ালি মানে প্রত্যেকেই নিজেরা মানে খুব র্যাপিডলি দেখে এর পরেটাই চলে যাব। প্রশ্ন আরেকজনকে
দেখবো না ভাইয়া, সমস্যা নেই, এটা দেখবো না, বলেন।
হ্যাঁ তাহলে
আমি বলতেছি এটা ইন্ডিভিজুয়ালি দেখবো না, তো সরাসরি কোশ্চেনে চলে যাবো।
হ্যাঁ হ্যাঁ যেহেতু এই মানে 1.5 মিনিট সময় আছে এখনো, 1.5 থেকে আর ব্রেকের 5 মিনিট, আমরা র্যাপিড দেখে চলে যাব শুধু। What is carcinoid? It is a slow-growing type of neuroendocrine tumor originating from neuroendocrine system. Most common site হচ্ছে stomach, small intestine, appendix, rectum, and lungs. What is the method to diagnosis carcinoid? Chromogranin A in blood, chromogranin B in immunohistochemistry, and 5 hydroxyindole acetic acid in 24-hour urine. What does it release? It releases histamine, bradykinin, serotonin, substance P, prostaglandin, and tekinin. Histamine, bradykinin, substance histamine, bradykinin, serotonin, substance P, prostaglandin, and tekinin. Which cell are involved? Enterochromaffin cell in crypt of liver cone. Enterochromaffin cells in the crypt of liver cone. Where does it become symptomatic, and why? When it is metastasized to liver, then it becomes symptomatic. Why? Usually, most of the substances produced by the carcinoid is metabolized and neutralized in the liver, but when it is metastasized in the liver, it becomes very easy to spread to the other part of the body before neutralizing and breakdown by the liver. So then it becomes symptomatic. What are the signs and symptoms of the carcinoid spread? Periodic abdominal pain. Okay, periodic abdominal pain, carcinoid syndrome, periodic abdominal pain, cutaneous flushing, diarrhea, asthma-like syndrome, and cardiac manifestation like valvular heart disease and fibrosis of the endocardium. Most common site of metastasis, liver. What is immunohistochemistry? It is a method of localizing a specific antigen. It is a method of localizing a specific antigen in the tissue or the cell based on the antigen antibody recognition procedure. The antibody are usually linked to an enzyme or a fluorescent dye, and when it is mixed with the tissue, then antibodies bind to the antigen in the tissue sample, and enzyme or dye are activated, and then antigen can be seen under the microscope. The significance of procedure is to detect certain antigen, which specialty do this pathology. Significance of immunohistochemistry in carcinoid to detect chromogranin B. After surgery, pseudomembranous colitis was suspected. Uh, Sign and symptoms: abdominal pain, bloody diarrhea, and fever. Only one test to detect pseudomembranous membranous from the colostomium is colonoscopy. Other test to detect pseudomembranous colitis, that is ELISA. Serologic test ELISA. What is Enterovirus vermicularis? It is a pinworm from the nematode family. Why this patient need regular iron supplementation? Because iron is stored in the liver as ferritin, but when and there is liver involvement by Enterovirus vermicularis, they can liver function is hampered and they can store. So there is continuous deficiency. To replace that one, we need iron supplementation. What is TNM classification of this tumor? As it invade mucosa, so it is T2, others NX, MX. What is the management needed for this tumor? If the tumor is symptomatic, then symptomatic treatment like somatostatin analog and antidiarrheal. If tumor size is more than less than 2 centimeter, appendectomy. If it is more than 2 centimeter, then hemicolectomy with lymph node excision, and right hemicolectomy, lymph node excision, and ileocecal anastomosis. End of the station. Next, a lady known to have ulcerative colitis and on surveillance colonoscopy is found to have a lesion less than 1 centimeter in sigmoid colon. A lady known to have ulcerative colitis and on surveillance colonoscopy is found to have a lesion less than 1 centimeter in sigmoid colon. Okay, less than 1 centimeter in sigmoid colon. So what is ulcerative colitis? It is a chronic inflammatory disease. Ulcerative colitis. Ulcerative colitis, it is a chronic inflammatory disease involving all part of the colon, characterized by inflammatory process confined to the mucosa and always involves the rectum. Okay, it is a chronic inflammatory disease. Ulcerative colitis হচ্ছে ulcerative colitis Crohn's disease. Ulcerative colitis মূলত হচ্ছে কোলনের. Yes, it is a chronic inflammatory disease involving all part of the colon, characterized by inflammatory process confined to mucosa and always involved in rectum. Again, it is a chronic inflammatory disease involving all part of the colon, which is confined to the mucosa and always in the rectum. What is the etiology or common site? Etiology, almost idiopathic. We don't know the cause. Maybe due to immunological, environmental, or genetic. Very simple. Etiology, almost idiopathic, maybe immunological, environmental, and genetic. So idiopathic, immunological, environmental, and genetic, and most common site is rectum. What's meant by backwash ileitis? Meant by backwash ileitis, involvement of the terminal ileum due to long-standing ulcerative colitis, no escape lesion. Yes. Okay. Involvement of the terminal ileum ইনভলভমেন্ট অফ দ্য ডিউটেরিনাম জেজুনাম, এটা হচ্ছে টার্মিনাল আইলিয়াম। ইনভলভমেন্ট অফ দ্য টার্মিনাল আইলিয়াম, বিকজ কারণ এটা হচ্ছে কোলনের, কোলন আলসারেটিভ কোলাইটিস হচ্ছে মেইনলি কোলনের, কিন্তু involvement of the terminal ileum due to long standing ulcerative colitis with no escapulation, কারণ এটা হচ্ছে ব্যাক, এটা শুরু মানে রেকটাম থেকে, রেকটাম, অ্যাসেন্ডিং কোলন, ট্রান্সভার্স কোলন, রেকটাম, সিগময়েড কোলন, ডিসেন্ডিং কোলন, ট্রান্সভার্স কোলন, অ্যাসেন্ডিং কোলন, এটা হচ্ছে উল্টা পাথওয়েতে এসে আবার এই উল্টা দিকে এদিকে যাওয়া শুরু করছে, টার্মিনাল আইলিয়ামকে ইনভলভ করছে এই জন্য। So the involvement of the terminal ileum due to long-standing ulcerative colitis with no escapulation is called backwash ileitis. Backwash normally flow হচ্ছে এই ডিরেকশনে, কিন্তু আলসারেটিভ কোলাইটিস আসতেছে উল্টো ডিরেকশনে এবং এসে টার্মিনাল আইলিয়ামকে ইনভলভ করতেছে। So involvement of the terminal ileum due to long-standing ulcerative colitis with no escapulation. Which treatment would you offer this lady and why? Treatment কাকে, যার হচ্ছে আলসারেটিভ কোলাইটিস আছে এবং কি বলছে আরো, লেডি নোন টু হ্যাভ আলসারেটিভ কোলাইটিস অন সার্ভাইলেন্স কোলোনোস্কোপি, আলসারেটিভ কোলাইটিস অন সার্ভাইলেন্স কোলোনোস্কোপি, সার্ভাইলেন্স কোলোনোস্কোপিতে আসছে আলসারেটিভ কোলাইটিসের পেশেন্ট এবং তার একটা লেশন পাওয়া গেছে 1 সেন্টিমিটার সিগমেন্ট কোলনে, তাকে আমরা ট্রিটমেন্ট কি বলবো? ট্রিটমেন্ট টোটাল প্রোক্টোকোলেক্টমি, টোটাল প্রোক্টোকোলেক্টমি উইথ এন্ড আইলোস্টমি। তার সার্ভাইলেন্স কোলোনোস্কোপিতে একটা লেশন পাওয়া গেছে <1 সেন্টিমিটার, এখন তার ট্রিটমেন্ট হচ্ছে টোটাল প্রোক্টোকোলেক্টমি উইথ এন্ড আইলোস্টমি, পুরো কোলন ফেলে দিতে হবে, সাথে আইলিওস্টমি, আইলিয়ামটাও, টার্মিনাল আইলিয়াম কেটে। ওয়াই দ্য হোল কোলন ইজ সাসেপ্টেবল, কারণ অলরেডি তার 1 সেন্টিমিটারের লেস দেন একটা টিউমার পাওয়া গেছে, এটা আরো বাড়তে পারে। ওকে, তাহলে ট্রিটমেন্ট হচ্ছে টোটাল প্রোক্টোকোলেক্টমি উইথ এন্ড আইলোস্টমি। হোয়াই? দ্য হোল কোলন ইজ সাসেপ্টেবল, দ্য হোল কোলন ইজ সাসেপ্টেবল, এই জন্য পুরো কোলন ফেলে দিতে হবে। প্রোক্টোকোলেক্টমি উইথ এন্ড আইলোস্টমি। ইফ দেয়ার ইজ লিভার মেটাস্টাসিস, তার মানে হচ্ছে মেটাস্টাসিস 1, what is the what will this affect TNM staging? Yes, it will become M1. What is the microscopic feature of ulcerative colitis? How does it differ from Crohn's disease? Okay, therefore some microscopic, macro না microscopic, under microscope আমরা কি দেখবো? আলসারেটিভ কোলাইটিস, আর এটা হচ্ছে Crohn's disease। আলসারেটিভ কোলাইটিস আমরা এখন করতেছি আলসারেটিভ কোলাইটিস, যেটা মূলত হবে কোলনে, তাহলে এখানে থাকবে ক্রিপ্ট অ্যাবসেস ফরমেশন, কারণ এটা শুধু থাকে ইনফ্লামেটরি সেল ইন দ্য ল্যামিনা প্রোপিরা। ক্রিপ্ট অ্যাবসেস কারণ সুপারফিশিয়াল, আর এটা ল্যামিনা প্রোপাইরাতে থাকবে ক্রিপ্ট অ্যাবসেস and inflammatory cell in the lamina propria। and Crohn's disease এটা মূলত হচ্ছে স্মল ইয়ে, এটাতে থাকবে গ্র্যানুলোমেটাস ইনফ্লামেশন, নন কেজিয়েটিং এপিথেলিয়েড সেল। Crohn's disease থাকবে নন কেজিয়েটিং এপিথেলিয়েড সেল aggregates with Langerhans giant cell। ওকে, এটা বলতে পারলেই হবে, নন কেজিয়েটিং এপিথেলিয়েড সেল, উইথ Langerhans সেল, এইগুলো হচ্ছে মাইক্রোস্কোপিক। নন কেজিয়েটিং epithelial cell with Langerhans cell, non-caseating epithelial cell, with non-caseating epithelial cell with Langerhans giant cell. What would you see on colonoscopy in ulcerative colitis and Crohn's disease? Okay, আমরা colonoscopy করলাম, এটা আলসারেটিভ কোলাইটিস আর এটা ক্রনস ডিজিজ। আলসারেটিভ কোলাইটিস মূলত আলসার, এখানে আমরা পাবো কি সিউডোপলিপ আলসারেটিভ কোলাইটিস, কোলোনোস্কোপি সিউডোপলিপ, দেন এক্সটেন্সিভ আলসারেশন, কারণ নামই হচ্ছে তার আলসারেটিভ, এই আলসারেশনের কারণেই আমরা পাই যে ক্রিপ্ট অ্যাবসেস ইন দ্য ল্যামিনার প্রোপেরা, ক্রিপ্ট অ্যাবসেস and inflammatory cell in the lamina propria। এটার কারণে যখন আমরা কোলোনোস্কোপি করব তখন আমরা পাবো যে সিউডোপলিপ সাথে এক্সটেন্সিভ আলসারেশন সুপারফিশিয়াল এন্ড কন্টাক্ট ব্লিডিং, এবং এখানে ব্লিডিং থাকবে, কন্টাক্ট ব্লিডিং। যখনই স্যাম্পল নিতে যাবে বায়োপসি, দেখা যাবে ব্লিডিং, বা টাচ করলেই ব্লিডিং হবে। সিউডোপোলিপ, সিউডোপোলিপ, এক্সটেন্সিভ আলসারেশন এন্ড ব্লিডিং, সিউডোপোলিপ, এক্সটেন্সিভ আলসারেশন এন্ড ব্লিডিং। আর কনস ডিজিজ থাকবে, কনস ডিজিজ যদি আমরা কোলোনোস্কোপিতে, খুবই ডিফিকাল্ট, আমরা তো কোলোনোস্কোপিতে যেতে পারবো না ওইটা। ওকে, কোবাল্ট স্টোন অ্যাপিয়ারেন্স, লিনিয়ার ফিশার, অ্যাট্রোফাইড আলসারেশন, থিকেন্ড বাউল ওয়াল। ওকে, কনস ডিজিজ আমরা কি দেখবো? কনস ডিজিজ এটা কোবাল্ট স্টোন অ্যাপিয়ারেন্স পুরো হয়ে যাবে, এবং থিকেন্ড বাউল ওয়াল, কোবাল্ট স্টোন অ্যাপিয়ারেন্স, and thickened bowel wall, linear fissure, atrophied ulceration, aphthoid ulceration, sorry, aphthoid ulceration। ওখানে ছিল superficial ulceration, extensive, এখানে aphthoid ulceration। দেখি কোনস ডিজিজে থাকবে কোবালস্টোন অ্যাপিয়ারেন্স, কোবালস্টোন অ্যাপিয়ারেন্স, কোবালস্টোন অ্যাপিয়ারেন্স, কোবালস্টোন অ্যাপিয়ারেন্স, কোবালস্টোন অ্যাপিয়ারেন্স, থিকেন্ড বাউল ওয়াল। হোয়াট ইজ ওপেন থিকেন্ড বাউল ওয়াল? তাহলে দুটোর পার্থক্য। আবার আলসারেটিভ কোলাইটিসে থাকবে পিউটোপোলিপ, এক্সটেন্সিভ আলসারেশন সুপারফিশিয়াল এন্ড কন্টাক্ট ব্লিডিং, এন্ড কনস ডিজিজে থাকবে কোবালস্টোন অ্যাপিয়ারেন্স, থিকেন্ড বাউল ওয়াল, অ্যাপথয়েড আলসার। What is the prominent clinical feature of ulcerative colitis? Ulcerative colitis মানে লার্জ গাটের যেটা, তাহলে অবশ্যই থাকবে ডায়রিয়া, এটা কমন। ডায়রিয়া, ট্রেনেসমাস এটাও কমন, ক্র্যাম্পি অ্যাবডোমিনাল পেইন, এই তিনটেই কমন, এবং আর রেক্টাল ব্লিডিং ও হবে। এক্সট্রা ইন্টেস্টাইনাল ম্যানিফেস্টেশন অফ আলসারেটিভ কোলাইটিস আমরা দেখব। তাহলে কমন কি কি থাকবে? পেশেন্টের থাকবে ডায়রিয়া, আলসারেটিভ কোলাইটিসের থাকবে ডায়রিয়া, ক্র্যাম্পি অ্যাবডোমিনাল পেইন, ট্রেনেসমাস, diarrhea, crampy abdominal pain, tenesmus, pararectal bleeding, and intestinal manifestation of ulcerative colitis. What are the complications? Ulcerative colitis হলে কি হবে? Toxic megacolon, fecal cancer, malabsorption, intestinal obstruction হইতে পারে, এবং fistula formation, abscess formation. Again, toxic megacolon, toxic megacolon, colon cancer, toxic megacolon, colon cancer, malabsorption, intestinal obstruction হতে পারে, টক্সিক মেগাকোলন, ক্যান্সার কোলন, malabsorption, intestinal obstruction হয়ে এখানে ফিস্টুলা ফর্মেশন, এবং ফিস্টুলা হলে এখানে ভিতরে পেরিটোনিয়াল অ্যাবসেস হবে। তাহলে টক্সিক মেগাকোলন, ইন্টেস্টিনাল অবস্ট্রাকশন, পারফোরেশন, ফিস্টুলা ফর্মেশন, অ্যাবসেস ফর্মেশন, malabsorption, এগুলো। Why does the patient have diarrhea? Diarrhea হবে malabsorption, intestinal motility and infection. Malabsorption, diarrhea কেন হবে? কারণ malabsorption increase motility, বেশি বেশি পাস হবে বলেই আমরা বলছি ডায়রিয়া। Malabsorption increase mortality and infection. You have a patient who is known case of Crohn's disease. The patient underwent terminal ileal resection for Crohn's disease, but still has diarrhea. Why? কারণ হচ্ছে malabsorption, short bowel syndrome, এই দুইটা ইম্পর্টেন্ট, এবং রিল্যাপস হয়ে গেছে Crohn's, আবার যেই কারণে অপারেশন হয়েছে ওইটা আবার আসছে, তার বাউল এখন শর্ট এবং ঠিকমতো ডাইজেশন হচ্ছে না, malabsorption। তাহলে রিল্যাপস অফ Crohn's, malabsorption, short bowel syndrome. Why are patients with Crohn's are more susceptible to renal stone? Increased intestinal fat due to malabsorption binds to the calcium, leaving oxalates or hyperoxaluria. Again, due to malabsorption, there is intestinal fat increase and it binds